to share them afterwards as well. So thank you very much for that wonderful introduction, Joanne. And I knew you as Mrs. Wickman when you were my homeroom teacher. 40 years ago, right now, I was in my second month as an exchange student in Brazil. Jean Cadwallader's daughter, Beth, was also in her second month as an exchange student at the same time. And for me, it's really a delight to be speaking to the club in Cortland. And I've only spoken once to the club in Cortland. It was right after I came back from Brazil. And frankly, wasn't such a great presentation, so I'm hoping it won't take much to beat that presentation this time around. So if you'll bear with me, I'm going to try to grab the screen, and let's see if that's going to work here. There we go. Share. All right. So I've titled my talk, COVID-19 in the 8th poorest country in the world, Flattening the Curve. And I want to point out that I am not an epidemiologist. I'm an armchair epidemiologist, but I have no formal training. But I have talked to a lot of epidemiologists and been trying to follow the science here. So first, I think I should tell you a little bit about the country I find myself in. And even before that, I just want to give a big thank you. Cortland Rotary Club, you changed my life. The opportunity to live in Brazil set me on a trajectory that I am still on. I've had the real pleasure of working as a teacher or doing relief and development work in quite a few countries around the world. I found my wife when I moved to Bosnia in 1999. Our son was born in Pakistan in 2006, and here I am in Mozambique, and none of that would have happened had Rotary not selected me to be an exchange student. And curiously, one of the reasons I got this job in Mozambique is that we speak Portuguese here, and I learned Portuguese as a Rotary student in 1980 in Brazil. So thank you so much. And now welcome to Mozambique. This is just one scenario in Mozambique, a dirt road in a rural area. Parts of the country look like this. We're a big country, and we have a vast terrain, and we have a lot of diversity in what it looks like. And I just wanted to give you some imagery. On the left-hand side here, we have the provinces of the country. And you may be able to see that we border Tanzania to the north, and then Malawi, Zambia, Zimbabwe, South Africa, and Swaziland, which is now renamed Eswatini. So we're in the southeastern corner of the African continent on the Indian Ocean. The right-hand side of this slide superimposes the map of Mozambique onto the northeast of the United States, just so you can see how big our country is compared to where you live. If you took the entire United States, continental United States without Alaska, you could fit the entire continental United States 3 times into the African continent. Mozambique was a Portuguese colony for an extremely long time and only got independence in 1975, much later than most African countries, and almost immediately went into a civil war. And we were in some ways pawns of the Cold War. We have a population of over 31 million right now. That's a little bit less than California, a little bit more than Texas. Life expectancy at birth here is rather low. Right now, if you're born, you're only expected to live 62 years on average. We're a very rural country with 62% of the population living in rural areas. And we've only got, this slide says 103 people per square mile. I've got another statistic that says 40. We're also an extremely young country with 83% of the population below age 40. And we don't make the news very much, but recently we've started to make the news for an unfortunate reason. We have an insurgency of violent armed conflict in the northern part of the country. I'm in the southern part of the country where the capital is. And that follows on discovery of massive oil gas reserves, as well as rubies and other extractives. And that may be feeding the conflict, we don't know. I had planned, if there was time, to do a little question and answer to tell you something about the country, but I really want to get to COVID, so I'm going to skip through that. Give you another brief aerial shot of one other part of Mozambique, just to give you a sense of some of the beauty that we have here. And just tell you a few more things about our current context for children in this country. We're tied with South Sudan as the 6th lowest scoring country on the Human Development Index. I think I said 8th poorest country in the world at the title. It every year we're slightly better, slightly worse. 57% of our people live below the poverty line, and that's $1.50 a day. Fewer than 50% of children actually complete primary school. 43% of children are chronically undernourished. 50% of girls are married before age 18. There's also very high pregnancy among adolescents. And we're also the third most disaster-prone country in Africa. You might remember that last year we were hit not by one, but by two Indian Ocean cyclones within a 6-week period, and that's never happened before. And they were both Category 4 cyclones, so really big ones. About 6 months ago, I read a study put out by Imperial College in the UK on March 25th, and it made some predictions about what COVID was going to do in Africa. And on the right-hand side here, you can see a bunch of African countries listed, and way down at the bottom is Mozambique. And the orange says that somewhere around late April, Mozambique ought to have 1,000 cases of COVID, and by mid-May, it should have moved up to about 10,000 cases. So the best case that they're modeling for Mozambique gave was that after 250 days of the epidemic, we would have 3.4 million people infected with COVID in this country, which would be about 11% of the population. Except that that's not what happened. And this slide here shows you last week across the world how many cases were reported. And right there in the center, you can see that most of Africa is under 101 cases reported per million people. And there's Mozambique down there. Now, South Africa, Botswana, and Namibia is a little bit higher. South Africa has really been driving the epidemic in the African continent, but most of the rest of the countries have just had much lower prevalence. And we're all trying to understand that. Here are some numbers for the country I live in. We had our first documented case of COVID on March 22nd. So we are now today 191 days since the pandemic started. There's a typo there. We've done contact tracing with 2.3 million people. We've had 134,000 people tested. 40,000 people have gone into quarantine. And number 6 on the bullet points, as of right now, 27th of September, we have 7,983 people confirmed cumulatively in those 191 days for having COVID. That's less than 0.03%. Or another way is 1 out of every 3,880 people has been tested as COVID positive. 61% have recovered. So our active caseload is under 50%. And very few cases were imported. It's been mostly community transmission. We're up to 51 deaths from COVID, and that's about double what it was when I presented to the Binghamton Rotary Club just under a month ago. So it is increasing here. It's increasing faster than it was, and we're getting worried. But it's still, relative to other parts of the world, not so terrible. These are some of the same numbers, just presented differently. And we have a few more statistics that I'm not going to go into. So you've all heard of flattening the curve, and this slide shows the whole concept of flattening the curve. Without protective measures, you overwhelm the health system. With protective measures, you flatten it out. I think Mozambique might be more or less where the yellow arrow is pointing here on the curve. We have not hit our peak yet, and we have not exceeded the capacity of our very weak healthcare system. We may still exceed the capacity. We don't know. It may be overwhelmed, but we're hoping that we've flattened the curve. And I ask myself the question, how did we do that? And here are the answers I have for you today. Again, I'm not an epidemiologist. So number one, the numbers may not be accurate. I don't think they're accurate in any country in the world. There hasn't been enough testing. Here in Mozambique, we have only 5 public testing laboratories, and we had only 1 when the epidemic started the first 2 months. I mentioned we have a very young population. 56% are below age 20, and 83%, I told you, below age 40. It's a highly rural country. We got 15.4 people per square mile. That compares to 421 per square mile in New York State. We have very high poverty, and so people just move around less. They can't afford to travel as much as people do in any other countries. Even before COVID, we had only 8 to 10 international flights a day coming into the country, so a few thousand people. And from late April, we've basically had most flights suspended. So there's been very little movement. And that's why we have such a small percentage of imported cases. We've had tremendous media attention. You cannot turn on the radio or the TV or look at a newspaper or walk around town looking at billboards and buses and not see messaging about COVID-19 and how to prevent it. There are questions about whether immune systems might be stronger in very poor countries such as Mozambique, where your average person is just exposed to a lot more illness and a lot more bacteria and a lot more viruses than we may be exposed to growing up in the comfort of Cortland, New York. And there's also a question as to whether with 68% of our population in rural areas with that remote population density, whether most Mozambicans just, they don't come across COVID much, they live their life outdoors, they're not very exposed. And so those are all possibilities and questions. But I think number 8 on my list is perhaps one of the most important ones. We've had a science-based response, and it's been a national response. Mozambique is a nation, it's not a federation like the US and other countries. So the federal government, the national government can impose things across the entire country. There's been required social distancing. They've required us to wear masks in certain public places. There's been a big increase in remote working, and we were told only 1/3 of the workforce could show up maximum per day at any workplace. There have been big limitations on religious and social gatherings, and churches have only reopened recently. The government closed bars, casinos, and cinemas. They closed gyms, and they still are not allowing any team sports. There's a big reduction of people coming into the country because of the closed airports and the closed borders. We've had limitations on how many people can be in public transport at any given time. And you can't walk into any public building, including my office, without washing your hands and getting a temperature check. In addition, I mentioned earlier, there's been 2.3 million contact tracing. So anytime there's a suspect case of COVID, they trace all of the contacts and they try to figure out who else might be in that transmission chain. In addition, in the public health clinics, there's tremendous surveillance. People come in, maybe they think they have a cold, they may be tested if they seem to show signs of COVID. Finally, the police, in some cases, and other government officials have been involved in actually enforcing the rules that have been put in place. So I've seen police, for example, going to the public transport and making sure that everybody's wearing a mask. And if somebody's not wearing a mask, they can be fined, they can be taken off public transportation, etc. And I think that probably makes a difference, especially in urban areas. And I have a couple additional thoughts as to why we may have fared well here. I read this in the Atlantic magazine recently. During a pandemic, leaders must rally the public, tell the truth, and speak clearly and consistently. And I have to say that I think the Mozambican government has done that. The president has addressed the nation many, many times and really insisted that we all follow the measures. We've been put under state of emergency. The Ministry of Health goes on TV every single day and gives us the numbers, gives us all the statistics. They're not hiding anything. And they have had a consistent and clear message for 191 days. In addition, Mozambique has benefited from foreign assistance. As I said, we're a very poor country. We couldn't do this alone. We've had tremendous technical support from the World Health Organization of the United Nations. There's been great financial support from the US government, European governments, others, multilateral institutions. The World Bank has been actually a really big player in terms of providing financing. The Jack Ma Foundation, I think Jack Ma founded Alibaba, provided test kits at a time when we didn't have, I think we had 1,000 test kits, and they sent us about 20,000 test kits so that we could keep testing. I hope I've respected the 15 minutes that I said I would speak in order to give a few minutes for questions. So let me pause it there and see if anybody has any questions. Over.
Chance, I think it's great that you have leadership there taking hold of the situation and giving you the right direction.
Thanks, Doug.
These are beautiful children. Look at those guys.
And these are second graders. These are second graders in the central Mozambican province of Manica. That's their standard textbook that's used all over the country. And actually in that textbook as second graders, one of the things they learn about is their rights, children's rights. And I think that's also fantastic that children are learning about their rights. Sorry, go ahead. Somebody was going to ask a question.
Yeah, I missed what your introduction was. What are you doing there?
I'm the country director for Save the Children. It's a nonprofit organization that works for child well-being and child rights around the world.
Wow, impressive.
Chance, how has the pandemic impacted your actual work, do you think?
Thanks, Joanne. So, well, it's impacted my work because it's given me more work, and most of my team have had to do more work. The first thing we had to do is figure out how to keep our staff safe in the face of the pandemic with so many questions. And that's been evolving as we've learned more about the science. So we have a team that's just been focused on trying to keep our staff safe and figuring out what to do if something happens to one of our staff members. Second, we had to figure out how to guarantee business continuity. We knew that as a nonprofit organization focused on child well-being, we could not just close our doors during a pandemic. In fact, that's the time to try to ramp up operations. Save the Children is 101 years old, and we were founded just after the First World War. And through much of our lifetime, what we've done best is go into difficult, challenging situations and try to help children. And so for us, COVID-19 around the world is an example of that. So after figuring out how to continue our business, what measures we would need to take in order to be able to continue functioning, how would we have people working from home? How would we deal with approvals? How would we transport people? How would we change the way we do things to reduce the risk? The next thing was to figure out how do we actually change our programming. In some cases, we had to adapt how we deliver our programs. For example, kids are out of school. Schools have been closed since March 30th here. So we had to figure out how can we help children with their education when they're not in school. And this is not a wealthy country where most kids can probably find a way to get on the internet and do online schooling. So we've had to adapt and adjust. We've done teacher training online. And I think if you asked me 6 months ago, could we do teacher training online in Mozambique? I would have said, no way. It's not possible. It won't work. And yet we're doing it. So we've adapted and we've pivoted, and we've also added COVID prevention programming. We've done a phenomenal amount of messaging. We have some animated characters of children. And so we created some 30-second animated spots that were played on the national TV, talking to children about COVID, assuming that the children may not pick up on the messaging that's designed for adults, but we need child-specific messaging. So we've had really a phenomenal amount of activities to try to help us adapt to the new situation, be able to continue working and actually do more for children at this time of tremendous need. It's a great question. Thanks, Joanne.
Thank you.
I have a question.
Ralph, thanks.
A lot of talk in our country, I guess throughout the world, concerning the development of a vaccine to combat the COVID. What's the feeling in Mozambique?
That's a good question. I think I can speak from where I sit. My team and I would be extremely relieved to see a vaccine come out. And this is a country where we have very big public programs to provide vaccines to children. So, in a wealthier country like the US, all parents take the responsibility to get their children vaccinated, we hope, in private health clinics or sometimes in government-run health clinics. And there are checks that make us do that, like you can't send your kid to public school if you can't prove that they've had a measles shot. Here, everything's provided by the government. And so there's a big culture of making sure that kids get their vaccines. And so we believe that if a vaccine were made available, that would just be added to the pantheon of vaccines that all children get here. We're concerned about the financial side of vaccines. No vaccine will be cheap. I believe Mozambique has joined into the COVAX initiative in which lower and middle income countries should get access to 20% of the vaccines once they're available, but that 20% may or may not be enough for our country, and it also would have to be paid for by somebody. So I think there's some practical concerns, but so I think there'll be good uptake here. I don't think we have. I know in some countries there are some subsets of populations who are worried about the safety of vaccines, and I think there's every reason to wonder whether COVID vaccines put together very quickly and maybe skipping some steps, that there is going to be the risk of safety concerns. I think in a country like this, I think people will accept that risk without question. I did want to say one thing about COVID here, which I probably should have said earlier. it seems right now that 83% of our COVID cases, those that have been tested positive, are asymptomatic, which is much higher percentage of asymptomatic, I think, than in other countries. And certainly in sort of the Northern Hemisphere, Europe and North America. And so that's a challenge for us because people feel fine and they don't necessarily know that they have it. They may be super spreaders. On the other hand, we may find over time, I don't think we'll get herd immunity, but we may find that we actually have a large percentage of certain populations that have been exposed. So we have done some surveys here, not Save the Children, but the government, where they've just done small surveys in cities. And here in Maputo, we have a big fish market. We're by the sea, so people like to eat fish. And I think they found that 12% of the fish sellers working in the market had antibodies to COVID. So suggesting that they had already been exposed, and almost none of them had actually been sick. So we may find that among certain populations, we have a high level of people have been exposed and have developed antibodies, never got symptoms. And so I think one of the challenges here will be to figure out, does everybody need a vaccine? Are there, again, there's a big scientific question, can people get reinfected, and what percentage of people who've had COVID once could get reinfected a second time or a third time? And I think we still don't know that. The cases of reinfection seem to be very, very rare. So there's huge questions about vaccines, but I would say overall, I think there's a lot of enthusiasm in Mozambique for the vaccine. Thanks for the question. And sorry, I went into a really long answer there and squeezed in a few other details.
Well, if there is another, I have another question, of course. You ready?
Sure.
How are you controlling your borders as far as this particular plague?
Sure. So one thing I should say is you saw Mozambique and you saw how big it is, right? Our coastline is pretty much about as long as from New York City to Miami. And that means that our land frontiers are even longer. And it's a very porous border. So the truth is, no country in Southern Africa can fully control their borders. There's a lot of movement. And we actually only have, 20 or so border posts in the whole country, where it's a formal border and there's a road and you can check in, get your passport stamped and all that. So many of those border posts have simply been closed. So there's no legal traffic. And if you tried to go through those borders, you would be stopped. So it doesn't mean, but you can walk over the land border just about anywhere. And if you have a 4x4 vehicle, I guess you could cross. So it's been imperfect. In addition, South Africa, which, as I think you all would probably know, has had very high incidence of COVID. They've passed their first peak and they're on the way down. They have deported a lot of Mozambicans, several thousand, I think, who were illegally in Mozambique, and they've deported them during the COVID epidemic. So I would say, probably more than 100 of our imported cases came directly from South Africa, from people being deported. So the borders were largely closed. Not anybody could just go across, but there were some exceptions for medical emergencies. In addition, we have cross-border transport. Mozambique depends on South Africa for a lot of goods. They get trucked in from South Africa. So we had to allow the trucks to come in, or we would run out of certain basic foodstuffs. And so there has been movement, and we really can't fully control the border, but I would say that the movement is significantly restricted compared to what it was pre-COVID in the pre-COVID normal.
Thank you.
Chance, I have a question. This is Harriet. I don't know if you can see me there. Yeah.
Hi, Harriet.
You started out your remarks by saying how important Rotary was to, you're launching your career globally.
Yeah.
And we appreciate that. Could you give us a little, color on what Rotary is doing currently in Mozambique? And to segue in, would there be any kind of a youth exchange opportunity?
Thanks. Those are great questions. I will first say that I'm not fully aware of what Rotary is doing in Mozambique. I believe there are 2 or 3 clubs. So not a huge number, but that, that's not surprising in a poor country. I know there's a club here in Maputo. I've lived here twice. I lived here for 4 years. I left and then I came back. And so toward the tail end of my first mission here, I was asked if I'd be interested to join the Maputo Rotary Club, and I was very interested, but I knew I would be leaving, and so I had to decline. And it wasn't clear to me at that time exactly what Rotary's activities were. I think we would find some similar activities that we find Rotary clubs around the world. And by the way, I think you all must have seen the news that that wild polio has been eradicated on the African continent. And that's fantastic news. And that's definitely thanks to Rotary and others who've worked so hard on it for so many years. And I really congratulate Rotary for the tremendous work and also financial support that's gone into making that happen. In terms of youth exchange, I don't know whether the Rotary Club here participates in youth exchange, but I could find out. I would be happy to make a note of that. From my perspective, it could be a fascinating place for youth exchange in both directions. There's, a very small percentage of Mozambicans who could afford the costs of doing youth exchange, I think, but I'm sure there could be a group of interested Mozambicans who would be interested in sending their children around the world if there were that opportunity. And I think it would be an absolutely fascinating place for a student from District 7170 or any district in the States to come to, particularly a city like Maputo, where we have, the healthcare is not terrible. And if something terrible happened, you can always go over to South Africa. That's where I do a lot of my healthcare when it's more than a sniffle. So I'd be happy to look into that with the club here if you want. I'm sure Rotary also has its own ways to get the districts talking. Did I answer your question, Harriet?
I was just
Harriet,
thinking,
you're on mute.
Yeah, all right, now I'm unmuted. Yes, you answered the question. And what I marvel about with Rotary is that it is international everywhere. And
Yeah.
somehow they get to places like, like Mozambique and they're able to make some great contributions.
Yeah.
And from your personal experience, how important, seeing what else is around besides in Cortland, New York. And so I just thought I'd ask. But it might be fun for you, Chance, to just go down to the Rotary Club and say, that you spoke to the Cortland Club and they were kind of curious.
I can definitely check that out. Yeah. Let me
Okay.
put that on my list of things to do.
Harriet?
Thanks.
Harriet,
Yes.
I think that most exchange student programs have been halted for the year.
Probably.
Mm.
But can think about next year or the year after or whenever we've
Right.
gotten over the worst of this pandemic, right?
Yeah, I think you're right, Gene, for this year, but there's always the future. There's always tomorrow.
We've been trying as a district to do a one-way exchange with a student in Tanzania
Oh,
for the past 3 years. These things take time. Yes, Chance, you have to find a Rotary Club there, but then you have to have some sort of an agreement between the two districts to do an exchange. What we're trying to do in Tanzania is a one-way exchange where a Tanzanian comes here.
okay.
And that's because their feeling is they don't have an adequate housing arrangement for an American to go there.
Yeah.
It's good to hear that you think that there are people in Mozambique who may be able to host, financially able to host a student. In the case of Tanzania, they have a not-for-profit on the ground that's paying the expenses for the student to come here.
Okay.
And actually they're splitting it with the district. The district here is putting up half the money. But I'm only saying that as an optimism because I think exchanges like that are very valuable, like it was for you, like it was for me back years before you. And to be able to cultivate an exchange in Africa would be fantastic.
Sure. Yeah. Well, I'm happy to look into it. And I would say in the neighborhood I live in, I would bet that easily 50+% of the people living in my neighborhood could afford to host an exchange student. Whether they'd want to is
Yeah.
entirely entirely a different issue. But yeah, we're an extremely poor country, but we have also some extreme disparities of wealth and income, and so there are people of means here who can afford to send their children to the American International School here, which seems like it costs almost about as much as going to university in the States. So, yeah.
Well, that's been very interesting, Chance, and thank you so much for sharing your experiences with us. Thank you.
Thank you all very much. It's really a pleasure and an honor and a privilege to be talking to the Cortland Club, the club that sent me overseas 40 years ago. And again, I just want to thank you from the bottom of my heart. It's lovely to see Jean Cadwallader and lovely to see Joanne Wickman, and also to meet the rest of you. And so thank you very much. I appreciate the opportunity to speak to you, and it's been enjoyable. So thank you. And I will stop sharing my screen, which I think means I'll give the control back to somebody, right?
Thank you.
Do you have control now?
Let me double check. No, I do not.
All right. Can you tell me how to give it to you? Sorry.
You see where your name is, and it's beside that it says host.
On my screen, it doesn't actually say that I'm host. So I'm sorry that I'm not.
Okay.
Yeah, it does say. No, I found it now. Okay, so but I don't see an option to make somebody else host.
You see where there's a camera, there's the speaker, and then there's a cloud.
Yep, I got it.
I'm not. That may at least turn off the recording.
Yeah, well, I can definitely pause the recording.